Do you really need to supplement with vitamin D? Today we're going to talk about everything involving vitamin D. Doses, uses, why would I take it, and when would I take it. First of all, what is vitamin D? We have two kinds of vitamins, fat-soluble and water-soluble vitamins. Vitamin D is a fat-soluble vitamin. You can find it in foods, dietary supplements, and UV rays that you can get from the sun. So, how much vitamin D should I take a day? Usually we measure vitamin D in international units. So you take like 10,000 IU or 50,000 IUs. The RDA for newborn to 1 year old, 400 international units equals 10 micrograms. From 1 year old to 70 years old can take up to 600, and over 70 years old, they should take 800 international units. For pregnancy and lactation, women should also take up to 600 international units. Now we know how much vitamin D should we take, but where should we take them from? Do we need to supplement, or is the sun and food enough? We have three main sources for vitamin D. First is food. Few foods naturally contain vitamin D, like fatty fish, like tuna, salmon. These are the best food sources for vitamin D. Fish liver oils, people usually take as supplements like the fish oil pills. Beef liver, egg yolks, mushrooms, and cheese have small amounts of vitamin D that can help to reach our goals, but they are not enough on their own. Some mushrooms in the market are treated with UV light to increase their levels of vitamin D2, which is approved by the FDA. These foods are called Fortified Foods. You can find the most amount of vitamin D in fortified foods, like milk. The second source and most popular is sun exposure. UV radiation type B penetrates the uncovered skin and converts 7-dehydrocholesterol to pre-vitamin D3, which in turn becomes vitamin D3 in the body. So what are the factors that affect UV radiation exposure and vitamin D synthesis in the body? Seasons, time of day, cloud coverage, melanin content, and sunscreen. You should take all of these in consideration when exposing yourself to the sun in order to take vitamin D3. Also, UVB radiation does not penetrate glass. Exposing yourself to the sun behind a window or behind like a glass door, you cannot synthesize vitamin D3 through that. You should go out and stand in direct sun. How long should I stay there? Experts say that you should expose yourself to the sun, including face, arms, legs, everything, without wearing sunscreen, without wearing like long shirts, for 5 to 30 minutes every day, or at least twice a week, between 10 a.m. to 4 p.m. Exposing ourselves to the sun causes cancer. Everybody knows that. Why would I use the sun as a source of vitamin D? Isn't it gonna harm more than benefit my goals? Exposing ourselves to the sun without sunscreen is not recommended. We should apply sunscreen with SPF 15 or more to stay safe. Anything with SPF 8 or higher will block the vitamin D production through UV rays. However, people don't usually apply sunscreen the right way or sufficiently. Like, they apply it to their face or under their eyes or something like that. If you're going to the beach and you're applying it once, if you're not applying it on your whole body multiple times a day, it's not enough to block the UV rays completely. So your skin will probably synthesize some vitamin D with the typically applied sunscreen amounts. The third and last source of vitamin D is dietary supplements. Usually dietary supplements have vitamin D3 and D2. Most evidence indicates that vitamin D3 increases the serum levels of vitamin D in the body, which is 25-OH-D3, to a greater extent and maintains the high level more than vitamin D2. People usually overtake supplements or do not take them and underconsume the amount of vitamins that they need. Who should supplement with vitamin D to prevent vitamin D deficiency? First of all, breastfed babies. The American Academy of Pediatrics, or AAP, advises parents to keep their children under 6 months old, dress them in protective clothing and hats, apply sunscreen to small areas that are exposed to the sun when sun exposure is unavoidable. They also recommend 10 micrograms or 400 international units for infants that are partially or exclusively breastfed, starting shortly after birth, until they're able to consume at least 100 milliliters per day of vitamin D fortified milk. There are a lot of categories that need to supplement with vitamin D like older adults, we have people with limited sun exposure, and also people with obesity who undergone the gastric bypass surgery. If I missed any other category, please mention down below in the comments under the like button. And don't forget to like the video and subscribe for more videos. And let's continue with the last two sections. The tolerable upper intake level of vitamin D from 0 to half a year or 6 months is 1,000 international units maximum. From 7 to 12 months, it's 1,500 international units. From 1 to 3 years, it's 2,500 international units. From 4 to 8 years, it's 3,000 international units. From 9 to 18 years old, it's 4,000 international units. That's for kids. And anything above 18 years old, also 4,000 international units, including pregnancy and lactation. What are the risks of taking too much vitamin D? In extreme cases, vitamin D toxicity can cause renal failure, calcification of soft tissues throughout the body, cardiac arrhythmia, and even death. So the last part is interaction with medications. Which medications does vitamin D interact with? The first one is Orlistat. Orlistat is a weight loss drug that can be used with a fat-reduced diet. So when taken with a fat-reduced diet and vitamin D, it can actually reduce the amount of vitamin D absorbed from food. Statins may also reduce vitamin D synthesis. Third ones are steroids. Steroids can reduce calcium absorption and vitamin D metabolism. The fourth and last ones are thiazide diuretics. The combination between thiazide diuretics and vitamin D can lead to hypercalcemia because thiazide diuretics keeps the calcium in the body. That's why it will lead to higher calcium levels and hypercalcemia. Fortified foods and supplementation is useful when it's not possible to meet the needs for one or more nutrients, but it's not mandatory. Please always check with your doctor before taking any supplements, and always do blood work to make sure that you're not over-consuming any supplements. If you like this video, hit the thumbs up, subscribe to the channel if you're not already, comment down below what do you want to know about next, and I'll see you in the next video.